Dengue fever is a viral illness transmitted primarily by Aedes mosquitoes, particularly Aedes aegypti and Aedes albopictus. It is one of the most common mosquito-borne diseases worldwide, especially in tropical and subtropical regions. The disease is caused by the dengue virus, DENV, which exists in 4 distinct serotypes, DENV1, DENV2, DENV3, and DENV4. These viruses are responsible for the range of symptoms seen in dengue fever, which can vary from mild to severe. Transmission of dengue fever. The primary mode of transmission of dengue fever is through the bite of an infected Aedes mosquito. The mosquito becomes infected when it feeds on the blood of a person already infected with the dengue virus. Once infected, the mosquito can transmit the virus to other humans through its bites, typically during the day, as Aedes mosquitoes are active in the early morning and late afternoon. Dengue fever is not contagious through direct human-to-human contact, but it can spread rapidly in areas with a high population of mosquitoes. The disease tends to flourish in urban environments where standing water accumulates in containers like flower pots, tires, and water tanks, which provide ideal breeding grounds for mosquitoes. Symptoms of dengue fever. Symptoms of dengue fever usually appear 4 to 10 days after being bitten by an infected mosquito. The illness often begins suddenly with a high fever and is accompanied by various other symptoms, including high fever. The temperature can rise suddenly, reaching up to 104 degrees Fahrenheit 40 degrees Celsius. Severe headache, often localized behind the eyes. Pain behind the eyes, a common complaint in dengue fever. Joint and muscle pain, known as break bone fever due to the intense muscle and joint pain. Fatigue and weakness, these symptoms can last for several weeks. Rashes, a rash may appear a few days after the fever starts and can spread to the body and limbs. Nausea and vomiting, common gastrointestinal symptoms. Mild bleeding, this can include nosebleeds, gum bleeding, or easy bruising. These symptoms typically last for 2 to 7 days. In most cases, dengue fever is self-limiting, and people recover with appropriate care. However, some cases can progress to more severe forms, such as dengue hemorrhagic fever, DHF, or dengue shock syndrome, DSS, which can be fatal if not treated promptly. Severe forms of dengue, DHF and DSS. Dengue hemorrhagic fever, DHF. This is a more severe form of the disease characterized by bleeding, blood plasma leakage, low platelet count, and damage to blood vessels. The symptoms of DHF include severe abdominal pain, persistent vomiting, and difficulty breathing. If not managed appropriately, DHF can lead to shock, organ failure, and death. Dengue shock syndrome, DSS. This severe condition occurs when the body goes into shock due to the severe loss of blood plasma, leading to low blood pressure, organ failure, and potentially death. DSS requires immediate medical intervention to prevent fatal outcomes. Diagnosis of dengue fever. The diagnosis of dengue fever is based on clinical symptoms and confirmed by laboratory tests. The presence of the typical symptoms, especially the high fever and joint pain, may raise suspicion. However, the diagnosis is confirmed through blood tests, which detect the presence of the dengue virus or antibodies produced in response to the infection. Polymerase chain reaction, PCR, tests, enzyme-linked immunosorbent assays, ELISA, and rapid diagnostic tests, RDTs, are commonly used. Treatment and prevention. Currently, there is no specific antiviral treatment for dengue fever. The primary approach to managing dengue is supportive care. This includes maintaining fluid balance to prevent dehydration, using pain relievers like acetaminophen, Tylenol, for fever and pain, and closely monitoring for any signs of complications. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin and ibuprofen, should be avoided as they can increase the risk of bleeding. Preventing dengue is largely focused on controlling the mosquito population and avoiding mosquito bites. Measures include eliminating breeding sites, removing stagnant water where mosquitoes breed, such as in containers, tires, and gutters. Using insect repellent, applying mosquito repellent containing DEET, picaridin, or other recommended chemicals. Wearing protective clothing, long-sleeved shirts, long pants, and socks can help reduce exposure to mosquito bites. Mosquito nets and screens, using bed nets and ensuring windows and doors are screened can reduce mosquito entry into homes. Vaccine for dengue. There is a vaccine called Dengvaxia, developed by Sanofi Pasteur, which has been approved for use in some countries for individuals aged 9 to 45 years who have been previously infected with the dengue virus. However, the vaccine is not recommended for those who have never had dengue, as it could increase the risk of severe disease upon subsequent infection with a different serotype of the virus. Conclusion: dengue fever remains a significant global health challenge, particularly in tropical regions. While most cases are mild and self-limiting, severe forms of the disease can lead to life-threatening complications. The best way to combat dengue is through prevention efforts, such as controlling mosquito populations and avoiding mosquito bites. Public health campaigns aimed at educating communities about the importance of eliminating breeding sites and using protective measures are essential to reducing the burden of dengue fever worldwide.